My turn. Good afternoon, and welcome back to the second annual Tarrant County College District Virtual Health and Wellness Fair. We want to thank you for attending this live event. Before we introduce our amazing speaker, I would like to take a minute to take care of a little housekeeping. Out of respect for the presenters, we ask that all attendees remain muted for the duration of the presentation. We value your feedback and comments and ask that you post those as well as any questions either in the comments section or on the Health and Wellness Fair website. These questions will be answered by the presenter following the presentation. Should we run out of time, any questions that aren't able to be addressed will be answered and posted on the Health and Wellness Fair website. During the presentation, if you can press on your reactions button and use the raise your hand button, we will recognize you following the presentation so you can ask your question out loud and in person. Okay? At the conclusion of the presentation, please take the time to complete the evaluation that will be posted in the comments section or again on the Health and Wellness Fair website. Your feedback is critical for program development and improvement. As a bonus, your completed evaluation will enter you into a drawing to win one of several health and wellness prizes that will be mailed to your home address. Please note, if your instructor is offering credit for attendance, you must fill out the survey and complete the information regarding your class and instructor. This presentation is being recorded and will be available for viewing via the Health and Wellness Fair website. If you have any questions, please reach out to Health Services. Now, I would like to introduce our speaker, Matthew Smith. Mr. Smith has worked for Tarrant County Public Health since 2020. His duties have included assisting with the Texas Vaccines for Children program, COVID-19 response, and prematurity prevention. He is a member of the Health Equity Alliance of Tarrant County that helps to reduce the amount of prematurity pregnancies through advocacy. To find out more about Mr. Smith, please go to the Health Fair website and find his full biography under the Speakers tab. Mr. Smith, it is my privilege to introduce you, and I would like to thank you for taking the time to be with us today and share your expertise so that we may learn about the preconception in college-aged minority women. Welcome, Mr. Smith. Proceed. Thank you.
Thank you. I appreciate it. Thank you. Hello, Tarrant County College. I'm Matthew Smith, and I'm with Tarrant County Public Health. And today I'm here to talk to you guys about preconception health and infant mortality, closing the gap. And that's talking about our preconception peer educators program. Let's go in a little bit more into depth into that. This is our first year running this program, but is a national program that has been successful in helping college students and the community to understand the importance of preconception health. I'm going to start by defining what a preconception peer educator is. Preconception peer educators, which are also known as PPE, are trusted members of the peer community who have knowledge of preconception health, an understanding of peer-to-peer support and training tenets. They understand where their peers are coming from and can tailor their messages appropriately. Now, what is preconception health and why is it so important? It is about learning to maintain a healthy lifestyle, whether you are pregnant or not. And it even pertains to males as well as females and why their health is important to preconception health. And it's a way for you to plan before you have a baby. PPE has three main campaign goals. The first is infant mortality awareness. The Preconception Peer Educator Program wishes to spread awareness about infant mortality. Did you know that Tarrant County has one of the highest infant mortality adverse outcomes in the state? And that is something one of the reasons we've implemented this program, and that's something we're trying to correct. And we're tackling the statistic with multiple approaches, including this program. What we plan to do is help spread awareness of preconception and interconception health messages. Now, what does that mean? Well, it means we can educate the public on things like eating healthy, taking a vitamin with folic acid, even if you aren't pregnant, getting the appropriate amount of exercise, getting the appropriate amount of sleep, consuming less alcohol, etc. These kind of health messages add up to a healthy lifestyle, even if you may never have a baby. But if you were to have a child in the future, taking care of yourself beforehand will have a positive impact on the outcome of your child. The second is targeting 18 plus population. We are targeting females and males with emphasis on college students and minorities. There is a huge disparity of infant mortality outcomes between minorities, as you will see shortly. This is something we are trying to correct through training your fellow students to be peer educators. Now, why peer educators? The reason being is people are most likely to listen to others that they know are active in their community. Arming you, the college students, with this information, we would hope can help others by receiving our training. As Tarrant County Public Health, we would look to partner with other universities to bring this program to their campus. We can also participate with students that are just interested in being part of the program. We're very accommodating on this and wish to work with whoever we can in order to spread the awareness of preconception health. I have a short video explaining the health disparities between African Americans and the general population. So, there we go. Start that. Can everyone hear it okay?
I can't hear it at all.
Oh no.
No, I can't hear it either.
Let's see here. Not sure if that was going to happen or not. We may have to end up skipping the video, which is unfortunate, but I'll explain the gist of it.
Maybe you can close and try it again. Sometimes.
Sometimes it does that. I'll try.
Yes.
Let's try reloading it. Also, we're rocking with captions here. There we go. At the very least, we have captions.
Still no volume.
No volume, unfortunately. Okay. I think we'll go ahead and I guess work with captions on this since that was something that I was not expecting, but we'll go with captions. And then when at the end of it, I'll explain more.
I can't hear anything. Does everybody else have that problem?
Yes, that is unfortunately an issue. Currently, all we have is captions. I apologize for this. And I apologize. It would have been far more entertaining with the sound, but captions at least let us see what was going on. But it's a pretty disheartening situation nonetheless. Nice back course. Now, the main gains of teaching you, the students, about preconception health is to arm you as educators with materials to reach peers and the community at large. In order for us to reach our target audience, we need ambassadors to be in the community spreading positive health information that could make a difference in people's lives and the community as a whole. We can do this in two ways. Training peer educators. This can either be done by the county or another educator that we trained at your college to help facilitate the learning of your peers. We recently trained our first batch of peer educators at Texas Christian University, TCU, in the nursing program. These students took 2 class sessions with a total of 6 hours of training in order to become certified peer
Just
educators.
his statement.
They then took their newfound knowledge and started educating on preconception health with the other underclassmen in their nursing department. Other outreach activities have been planned in their campuses to share this new knowledge. Now, you don't have to go actively around TCC telling everyone you're a peer educator like you're looking for work or anything, but just being there for others you might know or see struggling is enough. This brings us to targeted health messages. But what does that mean? Well, it's just about giving good advice that can be taken to lead a healthier lifestyle. Some of these topics could be like quitting smoking, eating a healthier diet, taking a vitamin with folic acid, and it's just those kind of messages, just something to stay healthy. When we train peer educators, we focus on several key factors, such as infant mortality. When we get into the statistics as the national birth mortality rate, birth weight, positive and negative outcomes of the child. This gives rationale as to why we think this training is important. Next is health disparities and minority health. We talk about access to basic pregnancy care, lack of resources, and how these outcomes can affect the child. Health disparities are unequal burdens in disease, morbidity, and mortality rates experienced by racial and ethnic groups as compared to the majority of population. The greater burden of infant mortality due to SIDS, which is sudden infant death syndrome, experienced by African American and American Indian families are some of the examples of health disparities. Next, we have African American health status and health literacy. And that's another big issue, especially in our community, that we're trying to tackle. Disparities in healthcare can be reduced by improving provider knowledge and awareness of disparities. Looking at how minorities are represented in research about health, improving people's access to care, ability to navigate health problems and health systems, effectively self-advocate, and making health systems more patient-centered. Unfortunately, what that means is African Americans have a disproportionately harder time trying to navigate the healthcare system. Next up, which is preconception care. These are the things that we've been discussing. And those are the targeted health messages that we've discussed, like vitamins, proper diet, and exercise. Disease management and resources. One of the goals of the PPE program is to help spread awareness of STDs, or also known as STIs, as resources on testing and treatment available provided by the health department. But it's more than that. There are tons of nonprofit federal programs, state programs, and more that many do not know about. And we want to increase the awareness of those resources so they can be used. Then there's preconception health nutrition. This includes things surrounding positive health messages such as exercise and weight management and eating the right foods. Now, the role of men. Men do have an important role in preconception as well. Health messages about staying healthy for males are important because they can affect the health of the mother via STDs or etc. We also discussed the 5 social determinants of health. The first one we usually discuss is education access and quality. People with higher levels of education are more likely to be healthier and live longer. Children from low-income families, children with disabilities, and children who routinely experience forms of social discrimination like bullying are more likely to struggle with math and reading. They are also less likely to graduate from high school or go to college. This means they're less likely to get safe, high-paying jobs and more likely to have health problems like heart disease, diabetes, and depression. Healthcare access and quality. Many people in the United States don't get the healthcare services they need. About 1 in 10 people in the United States don't have health insurance, though I think that might be a little bit higher. People without insurance are less likely to have a primary care provider, and they may not be able to afford healthcare services and the medications they need. Strategies to increase health insurance coverage rates are critical for making sure more people get important healthcare services like preventative care and treatment for chronic illnesses. Next is economic stability. In the United States, 1 in 10 people live in poverty, and many people can't afford things like healthy foods, healthcare, and housing. People with steady employment are less likely to live in poverty and more likely to be healthy, but many people have trouble finding and keeping a job. People with disabilities, injuries, and conditions like arthritis may be especially limited in their ability to work. In addition, many people with steady work still don't earn enough to afford things they need to stay healthy. One term you may have heard is the working poor. Social and community context. People's relationships and interactions with family, friends, coworkers, and community members can have a major impact on their health and well-being. Many people face challenges and dangers they can't control, like unsafe neighborhoods, discrimination, or trouble affording the things they need. This can have a negative impact on health and safety throughout life. Next is neighborhood and built environment. The neighborhoods people live in have a major impact on their health and well-being. Many people in the United States live in neighborhoods with high rates of violence, unsafe air or water, and other health and safety risks. Racial, ethnic minorities, and people with low incomes are more likely to live in places with these risks. In addition, some people are exposed to things at work that can harm their health, like secondhand smoke or loud noises. These can all be important determining factors for preconception health. Some of the factors influencing maternal outcomes include substance abuse, recreational drug use, and prescription drug use. Preconception health, your health before conception. And this is obviously the one that this program is focused on. Mental health, depression, anxiety, and mental illness. Stress, having a lot of stress and little support from family and friends. And domestic violence, which would be physical, sexual, or emotional abuse. We want the public to know that we are not just trying to disseminate information through this program, but we're building health ambassadors for better understanding of health and healthcare. Peer education and youth involvement, efforts we are trying to do with the PPE program. Information dissemination, becoming better as healthcare providers and providing information to the public, more outreach efforts, increasing awareness of preconception and maternal health. And we do this continuously by interacting with the public through various means such as this. Understanding the importance of preconception health in general, helping the public to understand why this is important. Building a common base of knowledge. We are in partnership with the community to help build the knowledge of healthcare and services that we and others offer the public. Understanding infant mortality in African American communities. We and other nonprofits are trying to make sure everyone is aware of the gap that persists in our community. And then learning to identify most common STDs is an important step in helping build public understanding of their health and prevent spread. And the role of men in preconception, and obviously the men have a big role in this to play. Now, some of the other efforts is, what are we doing as public health? Some of the things that college students and maybe the general public have no idea that we also work on. We improve access to critical services. We strengthen existing programs, screen those at risk for preterm birth, eliminate maternity care deserts, offer African American women tools to navigate the health system. We also improve quality of care provided to pregnant women. We train providers and address racism to build a more diverse healthcare workforce. We help create standardized assessments for mothers and infants. We adopt new models of care and link payment to quality. Mental health is another area we work on. Identifying barriers to access mental health services. Dismantle care barriers with a comprehensive approach. Screen for and address infant and early childhood mental health issues. We also help support families before and after birth. We try to expand access to programs that support families' basic needs. One of the things you may have heard of is WIC, which is Women's and Infants and Children, and we help give them access to healthy food. We also invest in community programs that offer one-stop comprehensive services. We help simplify enrollment across public benefit programs. We invest in home visiting. We fund community-based education, communications initiatives to support families. We also collect data, and that's through data collection and oversight. We help standardize birth and death certificate data. We mandate and fund fetal and infant mortality review committees, and we ensure equity in the review process. If you would like to know more about becoming a peer educator, please contact me at the following email, which I would have had mine up there, but also I have my health educator, which is Zelha Colazo. They'll be the most appropriate contact. And we'll be happy to guide you through any of the processes you'd like to learn about. PPE is an important step in the right direction of helping those helping us close the gap of minority infant mortality outcomes. We hope this presentation has enlightened you about what we are offering to the community, as well as how we are empowering the community to get involved in moving the needle. Thank you.
Thank you.
We want to thank Mr. Smith for your informative presentation and time today. We do have some questions. Lisa?
Absolutely.
Yes, we are open for questions.
Absolutely.
We didn't have any questions at this time.
There is one in comments. Okay, it's my question, so I'll ask it. Do you work closely with the Nurse Family Partnership Program at Tarrant County Public Health?
I'm part of their department. I am the administrative assistant for that area. So I do, from time to time, rub elbows with them. I don't work incredibly closely with them, but it is part of my initiative, and I do reach out to them for contacts periodically.
Okay, great. All right, if there are no more questions, again, we'd like to thank you, Mr. Smith, for your informative presentation and time today. Additionally, we want to thank all of our participants for your attendance today. Please remember to complete the evaluation that is posted in the Health and Wellness Fair website, as well as in the chat for those who can access the chat. We will be sending attendance information to your instructors from fully completed evaluations only. You can find information on our next breakout sessions on the Health and Wellness Fair website. The link has been posted in the chat for you, as well as on the Health and Wellness Fair website for those who can't access the chat. Thank you, and we look forward to seeing you in our next presentation.
Absolutely.